These are the components when doing the neuro portion of a head-to-toe assessment. You want to assess orientation, note the patient's response to simple commands, assess pupil size and the reaction to light, observe motor response of upper and lower extremities, test sensation bilaterally, and then use tactile or noxious stimuli if you have no response from your patient.
Orientation questions that you need to ask your patient is person, place, and time questions. For person, you're going to ask, can you tell me your name? For place, can you tell me where you are? And time, what is the month, time of day, last meal? Something that can indicate to us that they understand what time it is. When they answer all of these questions, we will determine whether they are alert and oriented times 1, answering 1 of them correct, times 2, answering 2, or times 3, answering 3 of them correct. We can also ask if they're oriented to situation if needed. If they answer that correctly, it would be alert and oriented times 4.
For the pupil assessment, you're going to be using a pen light, and you always want to travel from the side of the face to the mid-eye. First, you're going to look at the pupil that you're illuminating with the light. Then you're going to do it a second time and look at the other pupil. Both pupils should constrict as the light enters the eye. You want to make sure when you're switching from one eye to the other that you travel above the head or under the chin. If you flash the light across a patient's nose, then it might throw off your pupil assessment and be inaccurate. The average pupil size is 2 to 4 millimeters, and they should be equal on each side. You can use the guide on your pen light to estimate pupil size. They both should also be round in shape.
Hello, patient Kristen.
Hello.
I'm going to be doing a neurological assessment on you of your upper and lower motor response.
Okay.
So can you first squeeze my fingers with your hands? You have equal strength bilaterally in your upper extremities. Now I'm going to have you push with your feet on my hands like you're pushing down the gas pedal. Great. And then you're going to pull up on my hands with your feet. Perfect. So you have equal strength bilaterally in your lower extremities too. Hello, patient Kristen. I'm going to be testing the neurological assessment of your sensation in all 4 of your extremities. What I'm going to have you do is close your eyes, and I'm going to be touching you with the Q-tip. You're either going to feel the sharp side, which feels like this, or the soft side, which feels like this. So when your eyes are closed, I'm going to touch the soft side or the sharp side on one of your 4 extremities. You're going to tell me what you feel, soft or sharp, and which extremity you feel it on.
Okay.
Close your eyes.
That is sharp on my left arm.
Okay.
Soft on my right leg. Sharp on my left leg. Soft on my right arm.
Good job. You are neurologically intact with your sensation.
Hooray!
Thank you.